But we're here to launch the book, Global Mental Health Principles and Practice. It's got 4 authors or editors, who all the various booksellers on the internet describe in much the same sort of way, as being probably 4 of the field's most widely acknowledged champions and specialists. Vikram Patel, Martin Prince, Alex Cohen, and our own Harry Minas from the Centre for International Mental Health. And I suppose the book comes at a good time, because mental health comes and goes in terms of its salience on the national agenda and the international agenda. I think at the moment there's growing awareness around the world that what Alzheimer's is to older people, some of these psychoses are to younger people worldwide, and that is the most significant cause of chronic debilitating illness, and yet we don't give that the recognition it needs nor the resourcing that it needs. And so it's the right time for a book on global mental health to come along. It's the right time for a book that talks about the practice of how you can do better mental health services in places that aren't resource rich, and it's the right time, I think, for a book like that to come along, in terms also of making sure that anything we do build starts from the right principles, that there must be a really solid human rights base that underpins any of the work that we do in mental health. And that has always been one of the founding principles of the Centre for International Mental Health. That's why I think the centre sits so well within the Melbourne School of Population and Global Health, where many colleagues have exactly the same approach to the work that they do. And so I should introduce then Professor Terry Nolan, who's the head of that school, who's got a little bit more to say, I'm sure, about where this book fits in a general understanding of what we're doing in the fields of population and global health. Thanks.
It seems very formal for a small group to have a microphone and a lectern. Terry, thank you very much for both the introduction and for your continued support of what's happening with multicultural and global mental health in this university and more generally. Harry has been the flag bearer for us for a number of years now in this area and has done a superb job in bringing together a very powerful global network of other leaders at our sister institutions in North America, in Europe, in India and elsewhere. And in particular in creating a centre of gravity in the Southern Hemisphere for this region, extending into the Northern Hemisphere through Southeast and Southern Asia in particular, and through the establishment of the Mental Health Observatory and the Journal and many other things that have been Harry's initiatives. And so this book, which in a way I see as an outgrowth of the leadership program, in particular that Harry, Vikram and Alex Cohen have jointly led over a number of years, is an important, tangible resource, not just for the students who are involved in that program, but obviously much more broadly. And I do hope that this book gets very widely used. Terry mentioned the school. The school now formally incorporates the Nossal Institute. Mental health has been an important strength within the School of Population Health for a long time, but also within the Nossal Institute there are also important elements of global mental health there as well. And the whole idea of bringing together the Nossal with the rest of the school into this newly named school is to give us a much broader and stronger platform across the global health space. And in addition to that, we've restructured this year. We've created a new Centre for Mental Health as one of the 5 major divisions within the school. And the Centre for International Mental Health, as it was called, is now the Global and Multicultural Mental Health program within that Centre for Mental Health. Jane Perkis is the head of that centre. Tony Jorm is the other significant group leader within that centre as well. And so our belief is that mental health has for too long in the public health space, globally, nationally, whatever, been ignored. And so we've decided to formalise that, to really give it a concentration which it deserves, and to advance scholarship, engagement and global inclusive development in the mental health area, particularly in mental health systems, but more generally. And that's, of course, the work that Harry has been leading within this program. So, Harry, congratulations, and also to your co-authors, to all the contributors to the volume as well, many of you who are here tonight. A wonderful achievement. The book is obviously a high-quality piece of work, and I hope it really gets the use that it deserves. So, well done, Harry.
Start at the bottom and work up, I suppose. Could I introduce now also Professor Stephen Smith, who's the Dean of the Faculty of Medicine and all those other things that I can never put together in one phrase. Stephen, I'm afraid, but we know what it is. And Stephen is formally going to launch the book.
Thanks very much, and welcome everybody to this launch of this outstanding book. Global health, as we all know, is becoming quite a substantial issue worldwide. But one aspect of health, which was really up till recently at the sort of work that Harry's been talking about, has sort of slipped off the radar, and of course that's in the field which you all know about, which is mental health. Mental health is different, of course, in different societies. I've just spent 2.5 years in Singapore. I visited the Institute for Mental Health in Singapore, and I have to say I haven't seen such facilities since I last read Charles Dickens a good 100 years before. So it's quite clear that you have a major challenge in helping to change this situation. The other issue which you raised is, of course, the tremendous burden of ill health that mental disease, addiction and so on has on society. And again, it was only talking recently with Harry that I sort of reflected on the fact that most of this affects young people, it affects them for most of their lives, and it affects them, their families, and of course all the people around them. So the burden of disease is pretty colossal when it comes to mental health. When you put that into the global health context, because of the failure to recognise this in many countries, you can see the amount of work which needs to be done, and which you are doing, to begin to turn that around. The evidence now that you can intervene, which you have very much led at, is a further issue at stake, that whereas in the past just putting them into a home, keeping them out of the public, is not really an option. It's quite clear that it is possible to intervene with varying degrees of success over the lifetime and so on, but that requires a healthcare system to be constructed and a social system to be constructed that allows those interventions to occur. Many of the countries in Southeast Asia, as you well know, not to mention the large one north of Southeast Asia, have not really had these structures in place. So this is a colossal effort in terms of developing those services. And until you have books like this one, which actually brings together the theory and the practice, we're not really going to make any serious impact on this problem. So the book, as you know, is a truly international effort. There are 54 authors, and you'll be pleased to know I'm not going to go through all of them this evening. 18 countries have contributed. The 6 authors from here who've contributed, Grant Blaschke, Helen Herman, Ritz Kakuma, John Holy and Harry Minas, are our Melbourne contributees. And I think this is a book which has a very important part to play in the global health space, and it is a great reflection on us as a university that we are most definitely seen as one of the nexuses of this now increasingly global attack on this problem. You've already got some crits in, I know, from Richard Horton and Paul Farmer at the Harvard School. Thus far, all complimentary. But it gives me great pleasure to celebrate the publication of this book, Global Mental Health.
You don't need to be introduced, Harry. Harry's just back from Vietnam, in fact, and one of the great examples of what can be done in fostering a climate within which mental health can be better looked after internationally is the work that's being done in Vietnam at the moment, where a pretty substantial commitment from the government of Vietnam, matched by a real sort of on-the-ground enthusiasm for doing things better, has been pulled together in some ways in the International Mental Health Leadership Program. And what there'd be 50 or 60 people from Vietnam who at various stages now have come to Melbourne to share ideas with us and to be part of that leadership development task. You'll talk more about your book yourself, but in many ways when I actually read the literature and look at the core of the work of what the centre does, it's actually substantially about leadership development. It really acknowledges that the solutions to local problems are going to be found by local leaders, but local leaders equipped with certain skills and local leaders in touch with the communities that they serve. But anyhow, Harry will tell us more, I'm sure. Tell us what you think the book's about, Harry.
I'm not going to say much about the book. I really just want to thank the Dean, Professor Smith, Terry Nolan, for taking the time to launch the book and to bring some additional attention to this as an issue. Terry's support for this work has been unwavering for a long time, and without it I don't think we could have done very much. It's been really a source of considerable strength for the work, and Terry, I'm very grateful to you for that. I'm very pleased that we are now part of the Centre for Mental Health that Jane will lead. Jane, Tony and I will be responsible for 3 broad but very overlapping groups within the new centre. I think one of the issues of a program like the one that we run is that most of the money that we're able to get is actually spent somewhere else. And it means that the local base remains rather fragile. And being part of a much stronger and broader centre, I think, is a terrific way to go. I think it's a very positive development within the school, and I'm sure it's going to be very helpful to us in the further development of this global mental health work. Terry already mentioned that the book has had a pretty long gestation. I think the origins are in the International Mental Health Leadership Program. And when Alex and Byron Good and I and others developed the program in 2001, we didn't imagine that it would still be actually still operating annually 12, 13 years later. It's actually grown stronger over that time. Over the past 2 years, we've been able to provide full scholarships for 40 emerging leaders from Vietnam, from a variety of sources, and that's supported the kind of work that Terry mentioned, which is now very exciting in terms of transforming what's happening in Vietnam in relation to mental health. And we are privileged to, in 2 ways. One, to be involved in those processes of development in places like Vietnam, Indonesia, Sri Lanka, Nigeria, a number of other countries in Africa, to be involved in some regional programs, for instance, through ASEAN. And I think we're also very privileged to be part of a university that has such a strong commitment to having an international presence and a growing international presence. So we look forward to continuing to contribute to the university becoming a real global health powerhouse. I think it's fair to say that global mental health has now found an identity within global health. It is a pretty vibrant and exciting part of global health in terms of what's being developed over the past 10 years or so, and we are very pleased to be part of that development. So thank you all very much for coming to this launch of a little book which we hope will be influential in the coming period. And again, thank you very much to the Dean, Professor Smith, Terry Nolan, and thanks Terry Laidler for managing the process, and thank you all for being here. Thanks.
You're all still standing there. That's it for the formalities. The drinks and the canapes will continue until about 6 o'clock, so enjoy yourself and have a chat to one another. Thank you.